Everyone.
Thank you.
Morning.
We got a little time to kill, so
You do?
welcome to the Human Health and Social Services meeting. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Frazier, second by Supervisor Stroud. All approved?
Aye.
Carried. Okay. We'll start off with Chris. Chris, by the way, congratulations on your
Thank you.
award.
Yeah, thank
It's very
you.
nice to read about.
Yeah, thanks.
16 years?
Yeah,
Nice.
5 more to go. Yeah, thank you. Good morning, everyone. I going to point out there were a couple of corrections in the actual agenda. The resolution requests are correct, and I'll point those out as we go through them. The first action item is to add annual formula funds to the county budget. This is our annual allocation under the Workforce Investment and Opportunity Fund. This year's allocation is about a 9.6% reduction from the prior year. Most of that difference is the state is now allowed to withhold up to 15% of the total allocation for the state. So that's where most of the difference goes. Some of that money will come back to us. Some of it is being made available through the consolidated funding application the state is doing. But we're hoping that some of that will come back in the form of training funds during the course of the year.
Okay. Need a motion to get that on the floor, please. Motion made by Supervisor Frazier, second by Supervisor Stroud. All in favor?
Aye.
Opposed? Carried. Okay.
And I neglected to point out the correction on this item. Under rationale, that last sentence was a carryover from last year, and shouldn't have been in there. The we owe is replacing. We aren't adding a new account. These are existing accounts. The second item is also to amend the county budget to add funding for the summer youth program. We were awarded $85,703. This is where the typo is on the agenda page. The $82,916 is from last year, and we're hoping to have about 45 youth in the summer youth program through the TANF funding this year, and we're in the process of screening them and placing them.
Okay, motion to get that. Supervisor McDevitt, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried.
The third request is again a budget amendment. This is to add Trade Adjustment Act funding for one dislocated worker for $11,517. The money was awarded. We act as a pass-through for the federal funds.
Okay. Motion made by Supervisor Simpson, second by Supervisor McDevitt. Go right ahead, Supervisor.
Yeah, I just have a question.
Yeah, go ahead.
Specifically, what was the earning value?
I think it was one of the GE workers, but I'm not absolutely certain. Yeah. I can report back to the committee. Yeah. Yeah.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
We actually didn't see too many of the GE workers. Most of them were Washington County residents. Yeah. They had about $1 million. They had almost $1 million in Trade Act funding this past year in Washington County, mostly because of GE.
What would you retrain this person to do?
They're all different. We have what's called customer choice. It has to be an in-demand occupation, so it has to be an occupation where there's a high likelihood they can get new employment, and it also has to be on our approved trainer provider list. So those are the two main criteria that have to be looked at. Yep. The next request really goes along with the first. This is our annual allocation for temporary positions for training and youth work programs. Again, it's an annual authorization that's requested when we request adding our annual budget to the county budget.
Okay. Motion made by Supervisor Sieber, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried.
Again, the next one is also part of our annual process. We actually contract with Saratoga County Employment and Training for operation of the youth program, and this is to extend the contract for the current program year beginning July 1.
Motion made by Supervisor Brammer, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. We'll get through this quick.
Again, it's not like a broken record, another annual request. This is for the cost allocation plan with the Workforce Development Board. In your package on page 11 is a copy of the proposed budget for the Workforce Development Board. You see how it compares to the previous 3 years. There is a slight increase in the executive director and associate executive director's pay, but it's pretty much level funding from last year.
Okay. Motion made by Supervisor Simpson, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
The next request is related to our Summer Youth Award Ceremony and Picnic, a request to host a meeting or conference. This year it's scheduled for August 18th at the Crandall Park Pavilion, and this is the award ceremony where we honor the youth that were in the program during the course of the summer.
Thanks.
And the supervisors.
Motion made by Supervisor McDevitt, seconded by Supervisor Stroud. All in favor?
Aye.
Opposed? Carried.
And then the final request is to reappoint 2 members to the Workforce Development Board. Both of them, their terms expire on June 30th. Both are seeking to be reappointed. The first is Vondra Dagels from Glens Falls National Bank and Trust Company. She's one of their HR directors. And the other is Karen Winnie, who's the HR director of Unicor Technical Materials down in Primes Island.
Okay. Motion made by Supervisor Simpson, seconded by Supervisor Brammer. All in favor?
Aye.
Opposed? Carried.
And then just a point of information, at the last meeting, I received a request to host a meeting for the Workforce Development Board. That meeting is June 14th on the 9th floor of the Travelers Building where our office is located from 3 to 5. You're all certainly invited and welcome to attend. I will send out the agenda and more details later this week or early next week. But if you wish to attend, just let me know, and so that way I can recognize you at the meeting.
Excellent. Anything else for Chris or Sharon?
I'm all set unless there's questions.
Very good. Thank you, guys.
Thank you.
Hey, Rob.
Thank you. Thank you.
Yeah, nice. Super, super.
Thank you.
You're way up in this. You're way up in sugar. That's the whole trail. Whole trail. Jeep trails. Big statement. Wind power. We drove.
Whenever you are ready, Rob, it's all yours.
Okay, I just really have one quick item that I wanted to cover, and then I invited Dave Saffer, the Executive Director of the Council for Prevention, to give a little brief overview of his agency and the work that they're doing in the community. Oh, you need one more? My apologies. Okay, so what the resolution request on the back of the agenda, I did a should have a two-sider. Is to amend our 2016 budget to accept funds. This is considered 100% state aid in the amount of $4,486 to cover increased health and workers' compensation insurance costs. And this is for the Council for Prevention's budget and contract.
Okay. The motion, Supervisor Brammer, second by Supervisor Simpson. Any questions or comments? Okay. All in favor?
Aye.
Opposed? Carried.
In the county budget, we actually have a category where we classify this as federal aid. because it's actually a federal block grant that New York State pulls down, but we still call it state aid because it comes through New York State OASAS to us. So you may see it categorized in the actual budget as federal aid. And again, you know, I know folks are aware of our office. We're really the Office of Community Services. We often referred to as mental health, but we do cover 3 disability areas, mental health, substance abuse services, and developmental disabilities. And we have planning and oversight responsibilities locally for the 3 areas. And so today I asked Dave Stafford, who's the Executive Director of the Council for Prevention, if he could join us and give a little bit of an overview of their agency. We currently hold contracts in both Warren and Washington counties for approximately $222,000 per county with the council. No county dollars involved there, it's state dollars, state funding, state and or federal, considering how you classify it. And for a total of $447,000 that we pass through to the Council for Prevention, and they're doing a tremendous amount of work in the community. I'm sure that you have seen various activities they're involved in with the Hometown versus Heroin Coalition, and trying to raise awareness about the heroin epidemic and opiate abuse. So I'm going to ask Dave if he could actually join us, and I'll turn it over to you, Dave, to give an overview.
Thanks for the opportunity to address you. Rob's asked me to give you a little overview of what the council's doing. So, let me just, in terms of history, we used to be known as the Council for Prevention of Alcohol and Substance Abuse. In 2011, we changed that to just Council for Prevention, because we are now doing more than just substance abuse. We're doing a variety of mental health issues as well, and certainly the research has shown that you can address substance abuse without looking at mental health, and vice versa. The two are very much tied together. So let me start off again by saying that we do most of what we do is data driven. We need to have a purpose for what we develop services for. So we do a school survey every 2 years where we offer the schools the opportunity to participate in our student use survey, which also, the students also give us an idea of how they view their families, their schools, their peers, and themselves. Last survey was 2015. We'll be doing the next round starting in the fall. But just very quickly, let me just tell you that the top 3 choices in terms of substances are alcohol, marijuana, no surprise there. We used to talk about inhalants being our 3rd substance of choice. It's no longer true. The 3rd substance of choice in Warren County is prescription drugs, which is the precursor towards heroin and opioids. And so we'll get into that in a little bit. The other startling figure that came out of the last survey is we started to look at suicide. Suicide is prevalent and depression and suicide are prevalent issues amongst youngsters in both of our counties. 446 kids in both counties, evenly divided just about, talked about suicide attempts at least once.
Wow.
Yeah, that's a pretty high figure, one that we are very concerned about and have been mobilizing and will continue to mobilize to help our schools look at. That's not a topic that they normally have had to look at, but we are now doing safe schools trainings in suicide prevention. We're doing adult mental health training. We're doing adolescent mental health training, just to make people more aware. We also obviously have a suicide coalition that covers both counties, and I'll use information on that. It's also interesting that Rachel Sieber and I started doing stuff in suicide prevention probably 10 years ago, right? Problem has not diminished.
Well, I'm glad to hear there's that joint coalition now, and there's so much more prevention and awareness. And
There's also some new billboards that we just put up about
yeah.
suicide prevention down by Kmart and one on the way out to West Mountain. Okay, moving on from that, we do classroom-based services. By the way, in terms of the surveys, that includes all kids in grades 7 through 12 in all of Warren County School Districts. So it's not just a sample survey, it really gives us a pretty good representation of what is actually going on. We've been doing classroom-based substance abuse and mental health prevention in most of the elementary schools in Warren County. We have Students Against Destructive Decisions chapters in 4 of the county schools, natural helpers programs in 4 of the schools. And we started a program called Oveus, which is the most researched anti-bullying program in the United States. And we started bringing that into our school districts as well. Obviously, Oveus, O-L-W-E-U-S. Obviously, you've heard about anti-bullying programs. You've heard about bullying being an issue. And in many cases, bullying is the precursor to some of the suicide attempts. We'll be doing this with Queensbury this year. We'll be doing 18 days of prevention work with their summer school for the 2nd year in a row. We have a program that we started some years ago working with the Center for Recovery with adolescents who have a substance abuse diagnosis, trying to show them a different way to live that's substance-free and how they can use the environment to get a natural high. We've been working with the Bridges Out of Poverty program, and we'll be bringing those trainings into our schools, along with trauma-informed care trainings beginning in September. We've had several schools in Warren County who have asked for full faculty trainings on Bridges Out of Poverty. This is a whole nother area where we are trying to help schools understand that their role is not just reading, writing, and arithmetic, that there is a whole other responsibility that they have to their students. That's going to take some while to change the thinking. We also obviously do the Warren County Youth Court, which we have been administering since its inception in 1999. Longest youth program that we know of ongoing, and we can talk more about that at another time. And then, of course, there is the Heroin Coalition, the Hometown versus Heroin Addiction. We have done 19 forums in the last 19 months trying to raise awareness. Some of these, if you've been to them, have been really emotional events. From that has come a variety of other kinds of things. We have a group that's come out of that called NAS, which is Neonatal Abstinence Syndrome, looking at youngsters who have been born in the hospital to mothers who are addicted, a topic I never thought I'd ever be doing. But we had over 30 babies last year. We've been doing Narcan trainings every month. Narcan is a substance that can be given to people who are under the influence of opioid and will revive them, at least for the short term. We have a recovery group that's really developing the whole concept of changing the thinking about recovery, changing the stigma of recovery. In fact, they'll be doing a program next Wednesday at Crandall Library on the lawn, honoring the first responders locally who have used Narcan. And to my chagrin, we had thought there would be about 30 or 40 people that have used Narcan, and the number is like well over 100 responders who have used Narcan locally. The Post started 17 articles a year and a half ago, yet the epidemic and the issues remain. So as much as I can say that we have raised the awareness about the heroin epidemic, we have not necessarily cut down on the overdoses and the deaths. So we are now looking into how we can get to the 20s and 30s population, because that's the group that's really having the problem and dying. And with heroin, you have two choices. You get off it, or you die. Very little in between. Just giving you an overview of where we're at. Any questions, comments, thoughts?
Supervisor McDevitt.
Yeah, Dave and I chatted briefly at the start of the meeting, and Dave, I had read this statistic before, but Dave mentioned it. 80% of the opiates that are consumed in the world are consumed in this country, which is a staggering statistic. And I guess the question would be, probably a long answer, but why?
In the 90s, I'm gonna give you a very quick overview because it's a very complex question, actually. In the nineties, the pharmaceutical companies convinced the AMA that opioids were safe to prescribe. The AMA then said to physicians, you must begin to address pain management. And it doesn't matter whether you think the patient is in pain or not, nor does it matter whether you figure out how much pain they're in. We give you these little faces. If the guy turns and says, I'm at 10, you have to respond to him as if he has pain at that level. So, we started prescribing. Why not? AMA says I am neglect as a physician if I don't respond, whether I agree or not. And then from there it just literally mushroomed. That's the quick answer. It's much more complicated than I said.
That was very informative and somewhat sad to an extent.
I'm
but-
going to leave with you some resource guides that you can take to your offices if you like, from the Hometown Heroin Coalition about resources. I'll leave you some information on suicide prevention and mental health resource guides that have just come off the press. Thank you.
Thank you very much, Dave. Thanks, Rob. Okay, ladies.
Hand them down for you. Easier for you. Matt, hand those down. Here. Hello. I'm on a man.
Oh? Yeah, I understand what's happening.
Yeah, this side's all set, and then that side.
Only missed 2 days of work.
Wow, you are just. Mhm. Oh, gosh.
They didn't used to like to do that. Speak to Jackie about it, see what you can do. Thanks.
Maureen, when you are ready, take it away, okay?
Okay, I think we're almost set. Ready.
Go right ahead, my dear.
Okay, my first resolution request is, notice of intent to fill caseworker number 29 position in the Child Protective Services Unit. The salary $39,797, grade 16, step O, and the person was terminated effective 4/25/16. This is a mandated position. It is in our Child Protective Unit. It's very important that we try to keep that as filled as we can, because we just are receiving many, many calls, more than I think we have in the past.
A motion made by Supervisor Simpson, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
The second one is notice of intent to fill social welfare examiner position number 39 in the community Medicaid unit, and salary is $34,493, grade 8, step 4, due to resignation, effective 4/29/16. And this is a mandated position, and we had Before this, one of our Medicaid positions, we kind of eliminated when someone else, moved on, but we're at the point where we can't do that anymore for this. At this time, they would just drop us too low, while we still maybe are having a good year to 2 years of still keeping Medicaid, because the state's supposed to take it over sometime, but they're not near to it yet that I have heard.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Kramer. Questions, Supervisor Strauss?
Yes, is the base salary $39,797, or is it $39,979?
John, we're on two.
We're on
We're on two.
You wanna go back?
39,799, John, that's what the sheet
Okay,
says.
I thought one was the one that we had.
Which I do.
Oh, you're looking at the second one, the base is 32,300.
Right.
Yeah, but look at.
But then she has 34
Oh, no, there is a
on the first step. Well, I was wondering.
Hold on, we'll,
Isn't it the steps?
Attachment two? Yeah, the resolution.
Oh, I
is
see,
different than what-
I see. It's 979, okay.
Caseworker 29,
The
Okay.
resolution is correct, John, but the agenda is not.
Okay.
sorry.
The typo.
oh, okay, that's what I thought, because the 7 and 9
Yeah,
were
yeah.
just reversed, so, but I just wanted to clarify for the record.
Thank you very much.
Okay.
So on the second one, I'm sorry to jump,
Got
is the
base.
resolution correct?
Right, because there's a base and then the steps, correct?
Yes.
Okay, that's my question too.
Okay, so we have a motion and a second, for the second resolution, attachment two.
I,
All in favor?
Aye.
Opposed, carried. All right, on to three.
Number third is a notice of intent to fill
That's the base
the heat
salary.
intake clerk position in the reception unit, and that salary is $31,697, grade 4, step 8, due to retirement. That was effective 5/11/16. This is also a mandated position.
Motion made by Supervisor Simpson, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed, carried.
Mr. Chairman?
Yes.
Can you just clarify for me
Sure.
for one moment? Well, on these last two resolutions, attachment 2 and 3, I understand this is the base salary, so for example, 27 is different than 31, but it does say filling at step number if known. On the resolution, you know the step number, but on the agenda, but not on the resolution?
I could answer that one.
Okay.
What she's doing on the agenda, she's telling you the person leaving, whether, you know,
Okay.
retiring or whatever,
The
what they're
person's
going out at, that's their pay. And when we hire somebody, they're gonna come in at, an entry level, step 0. So you
Going
can
out
see
versus
the
coming in.
savings
Right.
between what's going out and who we're hiring.
Although if somebody moves from another position in the department, it might not be that savings as an entry
Well, and I think
level.
Jackie, she's not here, but I think she's capturing that now in a report, right, that we get monthly on the actual savings versus
Right,
potential?
right. Okay, item 4?
Item 4, notice of intent to fill resource clerk, number 3 position in the resource and recovery unit, salary $34,270, grade 4, step 11, due to retirement, effective 6/29/16.
Okay, this one, yep, this one's mandated as well, okay. Motion made by Supervisor Strauss, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed, carried.
I have, another, personnel request to kind of fill here, that was added to our agenda. We got the notice on Thursday, and actually I was out of the office on vacation, so we asked to bring it now because it's notice of intent to fill caseworker 27 position in the foster care unit, salary $41,924, grade 16, step 3, due to resignation effective 5/26/16. This is a mandated position, and this position we have struggled with for almost a year, with somebody being out, a long-term health problem, and then, brought in their resignation the other day, which is kinda sad, but, we're hoping that they get better, and foster care is such a needy area, we're hoping to be able to fill that. Thank you.
Maureen, just one quick item, I don't know if we need to change it on here, but on your sheet here, it has termination, and on your request, it has resignation. For this added item?
This is a resignation.
It's a resignation? Okay.
Yes.
But on the sheet that's attached to it, it says termination. You check the box.
Okay, sorry.
Just take the original and she can initial it.
The original is already, it's just the.
Oh, okay, good. All right, we're good.
Okay, thank you.
Okay, we need a motion, please, made by Supervisor Frazier, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried. Thank you.
Okay, now we're getting into our training and travel, with resolutions. 5, request permission for 2 unit supervisors to attend the NYFSIRL Cornell Supervisory Training. That was May 11th through 12th, May 18th and 19th, and June 22nd and 23rd. We got permission from Chairman Sokol to approve the May travel, but we're asking for that to be approved here at committee. And it's very important that our supervisors get training so they can be more effective in their duties, training people and taking care of things that come up in their units.
Motion made by Supervisor Seaver.
Can I move 5 through 9? They're all training requests.
Are they all training?
Right, they are.
Motion made by Supervisor Seaver to approve items 5 through 9, seconded by Supervisor Bramer. Any questions? All in favor?
Aye.
Opposed? Carried. Okay, thank you.
Okay. The first item on our agenda is permission to enter into a contract with Mahoney Notifier to do the maintenance inspection of our fire alarm system in the amount of $1,545.50. This is an increase of $31 from last year, and it is required by the Department of Health.
Made by Supervisor Strauss, seconded by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried.
The next 2 items kind of go together. A couple of months ago, I came to you asking for permission to put out for bid the replacement of one of our boiler systems. We got those bid results back, and that's in my packet. We need to look at those. But the lowest bidder was Madden Mechanical in the amount of $28,391. So I would like permission to borrow that money from the contingency fund, as we do not have it in our current budget, and then permission to have them come in and do that replacement.
Okay. So did you want to move items 2 and 3 together?
I believe that would make sense.
Yeah.
Good.
That's okay with the committee? Motion made by Supervisor Strauss, seconded by Supervisor Bramer. Questions? All in favor?
Aye.
Opposed? Carried.
The last item that we have is permission to enter into an agreement with BPI Mechanical and to pay them for repairs to our walk-in freezer in the amount of $5,123. We have 2 condenser units in the freezer, and one of them went, so we needed to replace one. And we are required to keep that at a temperature of 0 degrees per Department of Health regulations, so this will help us meet that.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried.
Next is the referral pending items. You gave us permission to admit out-of-county residents back in October. We do have currently one resident who is from another county. We have also sent out letters letting everybody in the Saratoga, Warren, Essex, and Hamilton counties know that we could admit out-of-county. I have also met with Elizabethtown Community Hospital. I've gotten a response from Saratoga County Department of Social Services to kind of let them know about us, and they're going to add us to their informational sheet as places to live. And the last item we have is our overtime report, which is on the back of the agenda. does show that we are down quite a few hours, but, the way that the paychecks work this year, Memorial Day was included in last year's at this time, but not this year, so we are still right about the same level that we should be, as opposed to last year.
Very good. Any other questions or comments for Dee? Dee?
For the social services revenue and expenditure report, we're pretty much on target, for the end of the fourth month of the year. Both spending and our revenue is pretty much on target where we were hoping to be. I don't see anything out of the ordinary or foresee any problems moving forward. And same with our overtime report. We're really, most of it is in our CPS where we have no control over it, and we're keeping it as down as much as possible.
Anything else, ladies? Thank you very much, and we may be going to have a tour next month at Social Services, but we'll let the committee know and via email as to what's going on. We do have one more item. Ms. DeResta could not make it here. She just has one item, Veteran Services. It is to approve the payout of 2015 vacation that was not rolled over. She was unable to take the time due to office coverage and being an IOD with the New York Army National Guard, which required medical care multiple times per week. So on the agenda that was just passed out, you can view here, where is there a total that's, or is it just based on time?
Doesn't have I don't see a dollar amount, on here, she just got the number of
Yeah, that's what I was
hours.
looking for.
But we'll have to go to finance first, so we'll have to.
Okay, so can we just get a motion to move this on to finance, please, made by Supervisor Simpson, seconded by Supervisor McDonald. Any, yes?
What's our current policy on the amount of hours that can be rolled over?
Oh, the amount?
5 days can be rolled over. If you have more than 5 days, you have to come to committee and request a payout for anything over the 5 days. 5 days is the total that you can roll over. But if you don't come in and request the payout, it's just zeroed out at the end of the year.
So she's asking the 31 hours just to be rolled over because she didn't request it before the end of the year?
She didn't request it. I'm just getting secondhand information from her and Jackie, but the way I understand it is she didn't realize that it wouldn't be automatically rolled over.
Oh, okay.
So what happened was she had her 5 days, which would have been, well, she's a department head, so it would have been 35 hours that they rolled over as vacation carryover.
Yep.
And the remaining 31 she had, since she didn't come to committee and request a payout on that amount, it's just zeroed out. So now she's asked, since she didn't
So
realize.
in addition to the 35?
Right, and because this is gonna fall under finance, Jackie most likely will be here. Denise probably won't, but Jackie can probably answer any questions that.
Well, I won't be here Friday, so I appreciate you answering my questions.
Thank you.
Okay, so, did we get a motion in a second?
You have a motion.
Okay. Any other questions? All in favor?
Aye.
Aye. Opposed? Carried. And finally, we just had a nice tour for those of you that did not make it. It was pretty neat to see the divisions downstairs, and Pat did an excellent job of explaining it. We also went over across the hallway to the WIC program. They are always there for another tour if anybody else needs to stop by and have any questions that need to be answered. So, with that being said, motion to adjourn, made by Supervisor Simpson, seconded by Supervisor Stroud. All in favor?
Aye.
Aye.
Carried, and it is 10:29.